My name's Lisa Peterson. I'm an organizer with the Rhode Island Women's Action Initiative, formerly known as Rhode Island Women's March. But I'm here today because I'm a licensed mental health counselor, a licensed chemical dependency professional, a licensed chemical dependency clinical supervisor, and a NADAC certified master addictions counselor. Thank you all for being here. I've been working in the treatment field for over 20 years, and never before have I seen such broad interest in making real change in the way that we address substance use and substance use disorders. Over the past 20 years, I've dedicated myself to the treatment of individuals, families, and communities impacted by substance use. Throughout my career, I've done everything in my power to help people find their pathway to recovery, as over 23 million Americans have done. I started this work after seeing how my loved ones who were using substances struggled to access appropriate treatment, instead ending up on the streets, in hospitals, and at the ACI. I thought, with the idealism of someone just starting out in the world, I can make this better, and I've never stopped trying. I've spent my career trying to make treatment better through direct care, program and policy development, and advocacy. There are so many reasons why this is a dangerous bill, and I don't want to repeat what my colleagues have said or will say today. But I have fought hard against this, and I needed to speak out one more time so that I know I did everything I could to make it better for people who are struggling with and dying from these treatable conditions. We know that people who use drugs also sell drugs. They barter and exchange things for drugs. Our family, friends, and neighbors do what they need to do to get by in desperate situations. What we may see as a rational fear of arrest or incarceration simply does not enter into the moment-to-moment efforts to just survive. On any given day, the dealer is the buyer and vice versa. This bill is extremely broad and will lead to more incarceration of individuals who had no intent, no malice, no knowledge of the ingredients in the product they were using or selling. The addition of a sharing exemption does nothing to protect individuals with substance use disorder from prosecution and lengthy incarceration. Currently, the ACI is the largest de facto provider of behavioral health services in the state of Rhode Island. This is not the role or expertise of these facilities, and they have neither the staff nor the resources to effectively meet the treatment needs of individuals who are incarcerated. And once released, people with substance use disorders face numerous barriers to reintegration. Wait lists for treatment, symptoms related to the trauma of incarceration, exclusions from housing and employment all exacerbate stress and are high-risk triggers for relapse, perpetuating the cycle of substance use. More incarceration will cause harm to families, communities, and individuals, and will divert millions of dollars from the already woefully inadequate behavioral health funding for effective interventions that make recovery a reality and return Rhode Islanders to productive roles in our society. For over a century, the U.S. has added law after law in an attempt to curb substance use, incarcerating millions and costing trillions of dollars. If the solution is to be found in criminal justice approaches, then why are we facing the worst crisis in decades? There's a saying that's popular in the treatment world when folks are struggling to make changes in support of their recovery. The definition of insanity is doing the same thing over and over and expecting a different result. The bill that the governor is about to sign mirrors the unsuccessful efforts of individuals with substance use disorders to try just one more time to get the outcome we want without actually changing our approach. It is clear that the historical effort to incarcerate our way out of a public health crisis has been ineffective, but our state has an opportunity to use what we have learned to make better informed decisions about how to proceed from here. We can try more of the same wrong solution, or we can invest in evidence-based practices and save millions of individuals and families from suffering the pain of substance use disorders and preventable deaths. I know that I plan to continue my efforts to do better for everyone who has been affected by substance use, and collaborating with all of you who share that goal gives me confidence that we will create meaningful change. Thank you.